Hi guys, my name is Dr. Manmeet and today I will be covering an approach to a joint problem. Basically, before I move on to approach, I want to tell you that there are certain diagnoses which you can't afford to miss. These are our red flag diagnoses, which are infection, any fracture, any crucial assisted arthritis like gout. These red flag diagnoses are the first one to be ruled out. Then we can move on to our approach and algorithm later on. So whenever we get a patient which is presenting with any joint problem, the first question that we have to ask ourselves is that whether the pain is coming or whether the symptoms are because of an articular involvement or it is because of a non-articular involvement. Now, the patient is going to give the history which is going to be classical. The articular structures, the pain is going to be deep-seated, boring, and it's going to be there on both active as well as passive movement. This is in contrast with those of a non-articular involvement where the pain is going to be localized. The patient can tell the pain comes on a particular movement, and the pain is going to only be there on active movement, not on passive movement. Once we know whether it's an articular involvement or a non-articular involvement, we can just go on to next step, whether we find out whether it's an inflammatory arthritis or it's a non-inflammatory arthritis. So, whenever a patient is having an inflammatory arthritis, the patient is going to have the typical features of inflammation. The temperature will be raised. There will be systemic features of inflammation. The ESR and CRP will be raised. There will be swelling. And the classical thing is that there's going to be a morning stiffness, which usually lasts in hours. In contrast with non-inflammatory, there will be minimal, temperature will hardly going to be raised. There will be minimal swelling, and the morning stiffness is usually less than 60 minutes. Now, once we know that whether it's an inflammatory arthritis, it's a non-inflammatory arthritis, we find out that whether it's an acute disease or it's a chronic disease. After ruling that out, we find out whether how many joints are involved, whether it's like a monoarthritis, whether it's an oligoarthritis, where around 2 to 4 joints are involved, or it's a polyarthritis where more than 4 joints are involved. Then we move on to our next step. We find out whether it is symmetrical or it's asymmetrical, and then we go on to our classical involvement of particular joint in certain situations. For example, in osteoarthritis, our proximal and distal interferential joints are involved. The base of the thumb is involved. Then we are knee and hip are involved. And in rheumatoid arthritis, we have certain joints which are involved. So that's how we commonly approach a patient who presents with a joint problem. If you like my channel and my lecture, do not forget to subscribe and like this video.